Okay, nipple cuts, nipple wounds, nipple trauma in breastfeeding are all due to poor positioning. The position of the cut can tell us what the cause of the injury is. If it is on the nipple tip, it is due to the nipple hitting the hard palate of the baby's mouth, and that's usually from things like nipple to nose, and they get it too quickly and they don't get the chance to exert a proper intraoral vacuum. If the wound is at the base of the nipple, so if the nipple is sticking up like this and then it connects to the areola, I should just go get my breast, but anyway, then that is due to the baby chomping down at the base of the nipple. The two reasons why babies do that is one, to stem the flow, they're trying to stop the flow so they have a second to breathe, or it is because they're using nipple shields, and the way they extract the milk is different with a nipple shield than it is directly from the breast. Both of those, we need to fix the offending problem. Even if you correct the wound and heal the wound, you will still have persisting pain. The problem with pain is that leads to inflammation. Inflammation will lead to inflamed breast tissue, which predisposes you to mastitis. The other place where we get damage is the areola area, and that is almost always due to pump damage. It is usually due to an incorrectly fitting pump shield and the areolar tissue being pulled into the tunnel, which is agonizing. Okay, so let's assume that I've got lots of information about nipple wounds and like suboptimal latches and how to heal them all on my Instagram. Go look at my nipple pain highlights, and I've got a lot of it because that's kind of what got me into this, because I've got I'm very good at fixing nipple pain. So now to the wound healing. Okay, if you have a simple cut, what we want to do is you can air dry it or you can use breast milk. If that doesn't work, and that should usually work within 12 hours. The particular, we don't completely understand. I'm actually doing a research project on the actual skin of the nipple areola complex, but we don't understand why it heals so well, but it heals amazingly. It is similar to a mucous membrane. So, the inside of your lip and other mucous membranes, vaginal tissues, things like that, they heal really well when they get a cut really quickly. And the nipple tissue and the areola is actually like that. So if you apply breast milk, and you should notice that it improves within 6 to 12 hours. It won't heal, but you'll notice an improvement. If breast milk doesn't work, or it's a bit too deep for that and it keeps on opening up, that means you need to scale up. Don't wait on this, because it will get worse. And what happens is when you have a cut, the body will keep on sending things to fix it. And if you keep on attacking it in the same way, which means the poor positioning, it will just keep getting worse and worse and worse, and it's just a never-ending cycle. And it doesn't have to be that way. The nipple is such a highly innervated organ. It is excruciating and it's agonizing. And the thing that breaks me is we just don't need to do that. It's going to take me 20 years to change the information out there, but that's the problem. And it's 9:30, so I went on a rant there. Where were we? Yes. So we tried using breast milk, and it hasn't worked. The next thing we want to go to is an ointment, a steroid ointment. And this is because it has anti-inflammatory properties, but it also will act as a barrier. And you just apply that 3 to 4 times a day. You can try an over-the-counter one if you're in a country that does that. If that doesn't work, there's a higher one. So if a patient comes in with established nipple trauma, I go straight to a strong ointment, because we want to be aggressive with it. But if you're trying to work it out for yourself and you can't get in to see a doctor, use one of the over-the-counter ointments. Apply that 3 to 4 times a day. You don't need to wipe it off before baby feeds. It should get absorbed already into the breast. Then we have more complex things. So we've got things like hydrogel and breast pads. Then we've got polymem and different types of dressings and things like that. But those are for actual fissures and deep nipple wounds where we might need to pack them. We might need to collect the ooze, all of those kind of things. Now, when you get a cut or a crack, you need to see a lactation specialist who can help you, okay? It's not normal. It shouldn't happen. It always indicates either a positioning problem or it's pump trauma. Inverted nipples is a slightly different thing, because sometimes they can have tissue reopen through poor positioning in the first few days, and it's difficult to heal. But even my patients with inverted nipples, we've had really good outcomes when we apply the principles of healing. What I think people wanted to know as well was about the silverettes. So silverettes are great, but they aren't doing anything. Or they're no different than putting just a cool, piece of metal, or I'm looking at a steel cup over there, putting something steel you're just liking the coldness. The actual silver of the silverette does not get leached into your skin the same way when you wear silver jewelry. It doesn't go into your skin. It is just providing cooling. And there's nothing wrong with that, unless you have an open edematous wound or a cut or something like that. And then what happens is that it reduces the airflow in the area because it acts completely like a blocker. There's no aeration, there's no normal healing. That wound then gets a little bit soaked with the breast milk and it becomes macerated and edematous. And I've had many of those come in with the use of the silverette. The initial feeling of the silverette is very cooling, especially around the areola and that tip, and it feels like you're protecting yourself from the background of the inflamed breast tissue. But any of you who've been my patients know that it does not help. Where I think people have gotten confused with the silverettes is because in medicine for wounds, we actually do use silver nitrate and it has great healing properties, but we use tiny little threads of silver to kind of vasoconstrict and heal things. Especially in the littles area of the nose where you get nosebleeds and things like that. That's one area where it's really, really good. But with a nipple wound, and you could actually use silver nitrate in a nipple wound, it's not always the best agent for healing, but those principles could apply for wound healing actually in a cut with a thread. But a silverette, the purpose of it, it's not doing what you think it is. Now, you're more than welcome to use it for cooling if it's helping you and you don't have a cut. If you do have a cut, get that cut addressed. Now, this is not actually a thing that people use for healing. This is the breast pads, the disposable breast pads or the reusable breast pads, whatever you have. I don't like them because they are often tightly inside the chest, inside the nursing bra, whatever it is. And the problem is that this area is so sensitive, and every time you move and it's not fixed in the way a bra is fixed, there's micro abrasions happening to that nipple. Now, if you have no nipple edema, no nipple pain, go ahead, use them to your heart's content. If you have a cut, this is making it worse. So what I recommend my patients do is you get rid of the hydrogel breast pads. Not hydrogel, the reusable breast pads. You get rid of the silverettes. You stop using lanolin and we replace it with a steroid ointment. We leave it to air dry as much as possible. If you can be without a t-shirt, great. If you can't be without a t-shirt, then just a simple t-shirt. Try not to keep yourself bound with any bras or anything like that when you're in the house if it's possible. Your comfort is what matters most, and we can always adjust if you don't feel comfortable with those things. So this is why a 60-second video is very hard to do, because there's such a range and such a scaling up of nipple trauma, nipple wounds, what causes it and the inflammation, and how to then address it. You can often get multiple different types of nipple and areola and then breast damage as well. You can have a cut and then you can have inflamed breast tissue because you've had an outlet flow of the milk. And then you can have a cut on the nipple, areola issues, and then breast pain. I see that very, very commonly. I rarely will see a cut without some inflamed breast tissue. And that's anyone who understands the principles of wounds and inflammation that will make a lot of sense to. If it doesn't make sense to you, go and watch, I think it's like my mastitis videos or my block duct videos, and check out my static posts on Instagram. They're very detailed, but if you read them a couple of times, it'll make sense. I hope that's a lot more comprehensive. I won't get all the answers. And remember, if something worked for you, that's great, but it may not work for everybody because the situations and the small little things can be very different. I've seen people have awful areola edema just due to using really strong pump settings. They think that if they really use that, they're going to get more milk. And actually what that does is causes massive, massive inflammation, and then it stops the outlet obstruction. And we actually see a decrease in supply. That's a separate topic. It's all connected, but it's all separate. So anyway, let's see how this one goes. Let's see what your questions are, and we'll go from there.